8 fatal diabetic ketoacidosis symptoms most diabetics ignore. And most are guilty of about 3. Diabetic ketoacidosis, often referred to as DKA, is a serious complication of diabetes that can be life-threatening if not promptly addressed. It occurs when the body produces high levels of blood acids called ketones, usually due to a lack of insulin. In this video, we will discuss the 8 fatal diabetic ketoacidosis symptoms that most diabetics tend to ignore. Recognizing and addressing these symptoms promptly is crucial in managing diabetes effectively. Ignoring these warning signs can lead to severe complications such as coma or even death. By understanding the significance of these symptoms and taking action when they arise, individuals with diabetes can better protect their health and well-being. Stay tuned as we delve into the potential risks associated with neglecting these critical signs of diabetic ketoacidosis. Symptom 1: Excessive thirst. Experiencing excessive thirst is a common warning sign of diabetic ketoacidosis. When blood sugar levels are elevated, the body tries to flush out the excess glucose through increased urination, leading to dehydration. This dehydration triggers a sensation of extreme thirst as the body attempts to replenish lost fluids. It is crucial for individuals with diabetes to monitor their fluid intake and recognize abnormal thirst patterns. Ignoring excessive thirst can exacerbate dehydration and worsen the condition of diabetic ketoacidosis. If left untreated, this symptom can progress to more severe complications such as organ failure. Therefore, it is essential to pay attention to changes in thirst levels and seek medical attention if excessive thirst persists despite increased fluid intake. Symptom 2: Persistent fatigue. Persistent fatigue is a symptom that can indicate underlying metabolic imbalances in diabetes, including the onset of diabetic ketoacidosis. When the body lacks sufficient insulin to convert glucose into energy, cells are unable to function optimally, leading to feelings of constant tiredness and exhaustion. It is important for individuals with diabetes to differentiate between normal tiredness and chronic fatigue, as the latter can be a red flag for diabetic complications. Managing energy levels through a balanced diet, regular exercise, and adequate rest is essential in combating fatigue associated with diabetes. Additionally, seeking medical advice for unexplained and persistent fatigue is crucial in identifying and addressing any potential underlying issues, such as diabetic ketoacidosis, to prevent further health complications. Symptom 3: Rapid breathing. Rapid breathing is a critical indicator of diabetic ketoacidosis, as the body attempts to compensate for acidosis, a condition characterized by high levels of blood acids called ketones. In an effort to expel excess carbon dioxide and lower blood acidity, individuals may experience rapid and shallow breathing patterns. It is crucial to recognize the urgency of seeking medical attention for sudden changes in breathing patterns, as untreated diabetic ketoacidosis can lead to respiratory failure and other life-threatening complications. If you notice persistent rapid breathing along with other symptoms of diabetic ketoacidosis, such as fruity-smelling breath or confusion, it is essential to consider it a medical emergency and seek immediate medical assistance to prevent further deterioration of health. Symptom 4: Abdominal pain. Abdominal pain can be associated with diabetic ketoacidosis in individuals with diabetes. The possible causes of abdominal pain in diabetic individuals may include gastrointestinal issues, such as gastritis or pancreatitis, as well as complications related to uncontrolled blood sugar levels. It is important for viewers to differentiate between benign stomach discomfort, which may be due to dietary factors or indigestion, and more serious abdominal issues that could indicate underlying health concerns like diabetic ketoacidosis. If you experience persistent or severe abdominal pain, especially when accompanied by other symptoms such as vomiting or difficulty breathing, it is advisable to consult a healthcare professional promptly. Early intervention and proper management of abdominal pain can help prevent potential complications and ensure optimal health outcomes for individuals with diabetes. Symptom 5: Confusion and disorientation. Confusion and disorientation are critical warning signs of diabetic ketoacidosis, indicating potential cognitive impairment due to metabolic changes in diabetes. When blood sugar levels are elevated and the body lacks insulin to utilize glucose for energy, the brain may not receive adequate fuel, leading to mental fog, confusion, and disorientation. It is essential for viewers to recognize mental changes such as confusion and disorientation and seek immediate medical help when these symptoms arise. In cases of diabetic ketoacidosis, confusion may escalate to a diabetic emergency if left untreated, potentially resulting in seizures or loss of consciousness. Therefore, it is crucial to prioritize prompt medical intervention when experiencing cognitive symptoms to prevent further complications and ensure proper management of diabetes-related issues. Symptom 6: Nausea and vomiting. Nausea and vomiting are common symptoms associated with diabetic ketoacidosis, often linked to the body's acidosis and high levels of ketones in the blood. Acidosis can irritate the stomach lining, leading to feelings of nausea and the urge to vomit as the body attempts to rid itself of excess acids. For diabetic individuals experiencing nausea and vomiting episodes, it is important to manage these symptoms by staying hydrated with small sips of water or clear fluids and avoiding sugary or acidic beverages that may worsen stomach discomfort. Monitoring hydration levels is crucial during episodes of nausea and vomiting to prevent dehydration, a common complication of diabetic ketoacidosis. Seeking medical advice if symptoms persist or worsen is essential to ensure proper management and prevent further health complications. Symptom 7: Fruity breath odor. Fruity breath odor is a significant indicator of diabetic ketoacidosis, attributed to the metabolic processes that occur when the body breaks down fats for energy in the absence of sufficient insulin. This breakdown results in the production of ketones, which can give the breath a distinct sweet or fruity smell. Viewers should be educated on detecting unusual breath odors, particularly a fruity scent, as it can signal a potential diabetic emergency. If you notice persistent fruity breath despite maintaining good oral hygiene, it is crucial to seek medical advice promptly. Fruity breath odor in the context of diabetic ketoacidosis should not be ignored, as it may indicate a serious imbalance in blood sugar levels that requires immediate attention and intervention to prevent further complications. Symptom 8: Muscle weakness. Muscle weakness can be a potential sign of diabetic ketoacidosis, as metabolic imbalances in diabetes can impact muscle function. When the body lacks sufficient insulin to utilize glucose for energy, muscles may not receive the necessary fuel to function optimally, leading to feelings of weakness and fatigue. Viewers are encouraged to differentiate between normal fatigue from physical exertion and abnormal muscle weakness that persists even at rest. Recognizing muscle weakness as a symptom of diabetic complications is crucial in managing diabetes effectively. If you experience persistent muscle weakness, especially when accompanied by other symptoms of diabetic ketoacidosis such as increased thirst or rapid breathing, it is important to consider it a warning sign and seek medical advice promptly to address any underlying issues and prevent further health complications. In conclusion, it is crucial for individuals with diabetes to recognize and address the early warning signs of diabetic ketoacidosis to prevent life-threatening complications. From excessive thirst and persistent fatigue to rapid breathing, confusion, and fruity breath odor, these symptoms should not be ignored. Muscle weakness, abdominal pain, nausea, and vomiting are also critical indicators that warrant immediate medical attention. By prioritizing their health and seeking prompt medical advice for concerning symptoms, individuals can effectively manage their diabetes and reduce the risk of diabetic emergencies. Awareness and education on the fatal symptoms of diabetic ketoacidosis play a vital role in empowering individuals to take proactive steps in their healthcare journey. Remember, Early intervention is key in preventing the progression of diabetic complications and ensuring optimal health outcomes. Don't forget to subscribe to our channel for more healthy diabetes tips, recipes, and wellness content. Like this video if you found it informative, and share it with your friends and family to spread the word about helpful diabetes tips. Together, let's embark on a journey to better health and vitality with the secret tips that are changing the game.